Hi, welcome to Good Nurse. I'm Nurse Ashley. Today we're tackling a fundamental skill every nursing student needs to master for the NCLEX, interpreting abnormal vital signs and spotting red flag conditions. Remember, this content is for educational purposes only and is not a substitute for professional medical advice. The NCLEX will expect you to recognize when a patient's numbers move from simply off to potentially life-threatening. By the end of this video, you'll feel more confident identifying not just what's abnormal, but also understanding the range of conditions these abnormalities might signal. Knowing this will help you pick the best, safest answers on the exam. Vital signs offer a real-time snapshot of a patient's internal balance, which is why the NCLEX often tests your understanding of them. Think of vital signs like a car's dashboard lights. One light might mean low fuel, another could mean engine trouble. Not every warning leads to an immediate crash, but ignoring it could bring serious consequences. On the exam, you might see a scenario of a patient who appears stable at first glance, maybe just a bit pale or tired, but if their heart rate is racing and their blood pressure is dropping, you should think, could they be in shock? Is there internal bleeding? The NCLEX loves these connections, testing your ability to move beyond memorizing numbers. Recognizing patterns early isn't just about memorizing ranges. It's about applying that knowledge to choose the right intervention when you see similar situations on test day. Let's go deeper into the 5 key vital signs: heart rate, respiratory rate, blood pressure, oxygen saturation, and temperature, and what their abnormalities might mean. On the NCLEX, these details guide you towards the best nursing intervention. First, heart rate. The normal range is around 60 to 100 beats per minute. If it's above 100, which is called tachycardia, think about causes like dehydration, fever, anxiety, pain, or something more severe like sepsis or cardiac arrhythmias. If it's below 60, which is called bradycardia, consider medications like beta blockers, maybe increased intracranial pressure, or an underlying conduction issue. The test might give you a patient with a heart rate of 50, for example, who's an athlete. That's normal. Or one who's dizzy and confused, which means you should suspect a conduction block or a medication side effect. Respiratory rate is normally 12 to 20 breaths per minute. Above 20 or tachypnea could signal respiratory distress, anxiety, or a brewing infection like pneumonia. Below 12 or bradypnea might point to opioid involvement, sedation, or neurological compromise. The NCLEX might ask which patient you check first, the one breathing 22 times a minute after a short walk, or the one at 10 breaths per minute who just received an opioid. The slower rate with opioids is obviously more concerning. Blood pressure is another key indicator. While normal varies from person to person, something like 90/60 to 120/80 is often acceptable. High readings over 140/90 could mean chronic hypertension, but the NCLEX often tests acute crises. If you see 180/120 plus confusion or neurological changes, think stroke or hypertensive emergency. Low blood pressure under 90/60 might suggest things like shock, sepsis, hemorrhage, or dehydration. On the exam, a post-op patient with a low blood pressure and a high heart rate should make you think internal bleeding or some other sort of fluid loss. Oxygen saturation should be between 95% to 100%. Anything below 90% is considered hypoxia. The NCLEX might present a patient post-surgery with an 88% O2 sat, and you should consider pain, sedation, or a pulmonary embolism. The question might be, what's your priority action? Possibly elevating the head of the bed, giving supplemental oxygen, or assessing for a pulmonary issue. Temperature is often around 98.6 degrees Fahrenheit. A fever above 100.4 degrees Fahrenheit usually suggests infection, while hypothermia under 95 degrees Fahrenheit might mean sepsis or an environmental exposure. The NCLEX might link a fever with other signs like tachycardia and hypotension to hint at sepsis, expecting you to act promptly. The important thing to remember is it's not just one number in isolation. The exam loves patterns. A patient with fever, tachycardia, and low blood pressure might be septic, as I previously mentioned. Another who's breathing fast but with a normal oxygen level could be anxious or just in pain. Identifying these patterns is about picking the safest and most logical next step, something the NCLEX frequently tests. Some values are obvious red flags that the NCLEX wants you to recognize immediately. If oxygen saturation falls below 85%, even with oxygen, severe respiratory compromise is likely. Don't hesitate. Think about interventions like increasing respiratory support or calling for help. A blood pressure of 180/120 plus neurological symptoms might mean a stroke or a hypertensive crisis. Your priority might be getting this patient immediate medical attention. A heart rate above 140 or below 40, coupled with symptoms like dizziness, confusion, or chest pain, could mean severe arrhythmias or impending cardiac arrest. The test wants you to recognize that this patient is in trouble and act immediately. A respiratory rate above 30 or below 10 is also critical. Above 30 can mean respiratory failure is imminent, while below 10, especially if the patient has received opioids, might suggest respiratory depression. The exam might ask you what to do first. Often administering naloxone or supporting their airway is key. When studying, remember that the NCLEX tends to focus on common scenarios, not obscure disorders. Tachycardia, think dehydration, infection, or anxiety first. Low respiratory rate, think opioid effects. Hypotension, consider sepsis, hemorrhage, or anaphylaxis. The point is not to memorize every cause under the sun, but to recognize the most likely culprits the NCLEX cares about. For nursing students preparing for the exam, practice is your best friend. Every practice question is a chance to interpret vitals. Don't just look at the number, think about why it's abnormal. Is the patient's blood pressure low because of bleeding? Or might they be on a new antihypertensive medicine that the test wants you to recognize as the cause? Understanding the rationale helps you apply these skills to any question the exam throws at you. Remember, interpreting vital signs for the NCLEX is about more than just knowing the normal ranges. It's about connecting the dots between the data and your clinical judgment. If the heart rate is up and the blood pressure is down, think shock or internal bleeding. If the oxygen saturation is low, consider respiratory interventions first. If multiple vitals are off, prioritize the one that poses the greatest immediate threat to life, usually airway, breathing, or circulation. Thanks for watching Good Nurse. Interpreting vitals and identifying red flags can feel overwhelming, but with practice, you'll get more confident. Each scenario you review helps you recognize patterns and choose the best possible answer on the exam. If you found this video helpful, give it a thumbs up and subscribe for more NCLEX focused tips. I'm Nurse Ashley, and I'll see you in the next video where we'll continue breaking down complex concepts into simple test-ready insights.